Hey everybody, and welcome back to the Millennial Project. I am winging it just a little bit today because I had for a few days been doing some really interesting research into Obamacare. And my goal is to put out a video about, how we can have a more productive conversation on Obamacare. Well, last night when I was getting ready to film the video, suddenly the Republicans released their Repeal and Replace plan. And I decided, at first I didn't want to do the video, and then I decided maybe I should do the video, and then I was like, where am I going to film it? And all this stuff started coming up until basically I just decided I'm going to go out there, I'm going to talk about the same research that I encountered before this new plan was ever released, and hopefully offer just a few preliminary reflections on what the plan may or may not do, or what the plan may or may not address. So with all that in mind, like I said, this is a little bit, just kind of happening as we go here, but the research that I'm referencing, I have been looking into, I've been talking to the experts who did the research as well, and I think it will help us have a more productive conversation, not just about Obamacare, but about the repeal and replace effort that is currently underway and that probably will be lumbering on for a really long time. So with all that in mind, the research that I'm talking about, the report that I have been looking into for background research on this Obamacare video came out of the Brookings Institution. And it has kind of a complicated academic-y name, but in general, what the report was supposed to do was kind of understand what has and hasn't worked about Obamacare since the Affordable Care Act was implemented just a few years ago. So to my knowledge, the first year that this thing actually came into effect was 2014. And this report kind of tried to show, what has been happening in 5 different states. So the states that were looked at were diverse politically and geographically. They are California, Michigan, Florida, Texas, and North Carolina. So you have California on the one hand that worked very hard to implement Obamacare with the federal government, to do it well, to make sure the law succeeded. Then you have other states like Texas and Florida that really dragged their feet, in some cases even overtly opposed the implementation of Obamacare with laws in the state legislature, and that have not really been very proactive, to say the least, in making the law successful. So what these researchers did for this report is they went to their states and they talked to a wide variety of stakeholders in the healthcare industry. And they tried to understand, how the Affordable Care Act had been implemented. And then they wrote up summaries for each of their states, and then they kind of produced one collective report that has 4 kind of major takeaways from Obamacare over the past few years. So what I want to do in this video is just run through those takeaways. So the first thing, and I think this is just so interesting and so critical to this ongoing discussion about repeal and replace, the first takeaway is this idea that healthcare is very local. Now, this may seem counterintuitive because for the last several years we've had politicians, especially anybody looking for a position in Washington, running around talking about Obamacare and health policy and how it's either the greatest thing in the world or how it needs to be, blown up and replaced with something completely different. The reality, though, is that healthcare markets are very local, and the reason for this is actually pretty self-explanatory. It's because if you break a bone or you get sick or you have a heart attack, you're not going to be getting in the ambulance and driving 1,000 miles to the one hospital in the United States that happens to have the best healthcare service that you need at the very lowest cost. Instead, you're going to go to a hospital that's close to you. Maybe you have a choice between a few different hospitals wherever you live, but most likely you're just going to one hospital that's very close to you. The result of this reality is that healthcare prices and insurance prices tend to vary dramatically across different geographies. So, what's really interesting actually is that I live in Los Angeles, and West Los Angeles under the Affordable Care Act is one healthcare market, whereas East Los Angeles is a different healthcare market. And so if I move to a different neighborhood, I could be in a different healthcare market, different prices, etc. This phenomenon is replicated in geographies across the country. So from city to city, state to state, region to region, you have people having very diverse and different experiences with healthcare policy, including Obamacare. And I think this is just so important as we talk about the Affordable Care Act and repeal and replace, because I think a lot of people on the national stage try to make this sound like a relatively simple issue. They say basically, there's one major problem, its premiums are going up and it's a lack of competition, and if we do these 2 things, it's going to roll out consistently across the United States and it's going to fix our problem. I think that this is probably a big misconception, and I think that it's important, if we're going to look at how to have a productive conversation on Obamacare, that we recognize the vast diversity of experiences with the Affordable Care Act and healthcare policy in general. So that is just the first insight from the report. I'm going to move a little bit faster through the rest of the insights, but I think that that is all really important. If there's one takeaway from this video, it's that healthcare is local. So the second insight from the report, again, very interesting, is that insurance companies really underestimated the number of sick people who were going to seek care under Obamacare. So even though, these insurance companies have, armies of statisticians and risk assessors and stuff like that, they still underestimated the number of sick people that they were going to have to insure. And the result was that they weren't able to make money on these exchanges. They didn't set premiums right, and it's been a consistent problem ever since the exchanges came online in 2014. So I think this is important, not to say that the exchanges are failing, because I don't know if that's necessarily totally accurate. I think what's more accurate is to recognize that some of these really big insurers like Humana, Aetna, United Healthcare have been pulling out of these local markets because they're not able to turn a profit. Some other more regional insurers, though, have been able to survive, and while it's been tough, they've done things like increase premiums or try to narrow their health networks in order to, control costs and get a little bit of extra money in order to plug this kind of runaway, cost of people with pre-existing conditions. So that brings me to the third insight in the report, which is that doctor choice is narrowing. And the reason for this, again, has to do with cost. As insurance companies have tried to control cost of the services that they need to pay for, what they have done is they have tried to funnel more and more of their policyholders towards one hospital. The general idea is basically that they can buy healthcare services like, getting a cast or a checkup or having heart surgery wholesale, right? So if you have more people funneling towards one hospital, you get a better price. The problem, though, is that the result of this has been that people have not necessarily been able to keep their original doctors from before they got onto the Obamacare exchanges. And this breaks a fundamental promise that President Obama made when they first passed the Affordable Care Act, which said if you like your doctor, you can keep your doctor. I don't think that Obama was able to foresee this issue of of too many sick people coming onto the exchanges, but nonetheless it happened, and it has been a big driver of discontent with Obamacare. The fourth insight that comes out of this report talks about competition amongst hospitals. So essentially what the report is saying is that hospital competition may be just as important to insurance provider competition in making sure that prices are low and affordable for people who are seeking healthcare, people like you and me, right? So the way we've thought about Obamacare traditionally is that it's all about insurance provider competition, that if we get all of these insurance providers onto some market, kind of like kayak.com for insurance, and you can go there and you can easily see, all the different premium prices, what the plans are going to cover, and all that stuff, that we can drive prices down because the power will be in the consumer's hands to really find the lowest price. Well, when insurance companies set prices, they have to negotiate what they're going to pay for each healthcare service with a hospital. And so if there's only one hospital in a given local area, because remember, healthcare is very local, then these insurance companies have trouble negotiating competitive prices. This means that if you live in an area where there's only one hospital or maybe two hospitals, you're probably going to have higher premiums than someone who lives in an area with a lot of hospital competition. So this is really apparently visible in California. Again, where I live in West Los Angeles, there are a ton of hospitals. I can make it to 3 really great hospitals just within the area that I live in. But in other places, even some other urban areas like San Francisco, there is less competition amongst hospitals. So in San Francisco, you've had consolidation amongst hospital networks, and again, that has helped drive premiums up. Another issue is, again, in rural areas, places like Northern California, where there might only be 1 or 2 hospitals for people just because there's not a lot of people out there. Again, you have higher premiums. So the difference between premiums in Northern California, which again is more rural, and Southern California, which tends to have a lot more urban areas, the difference in the premiums is roughly 30%. So that's a big number. It has a major impact on people's lives, and it's just something to really keep in mind as we continue hearing about this repeal and replace effort from the Republicans at the national level. So I don't have, immense expertise in this area. I see myself more as a conduit between you, the viewer, and some of this more academic research. But what I do worry about is that the Republican plan that was put forward last night, may not really be addressing some of these basic problems with Obamacare head on. And I say that because, originally I thought the Republicans were going to basically repeal everything and then replace it with something completely different. Well, it now appears that they're going to sort of leave a lot of the nuts and bolts and the regulatory regulatory parts of Obamacare in place and just kind of cherry pick parts out that they want to change. And so I'm not really sure what that means for the future of healthcare in the United States. What I can say is that I do think it makes these issues that were brought up in the Brookings report very relevant to the continuing conversation about repeal and replace. And I also think it brings up some questions about whether the repeal and replace effort that is currently lumbering on really is going to be able to achieve the goal of making healthcare more affordable and more accessible and of higher quality, or if instead it's basically just going to kind of shuffle around what we already have to make it look more Republican and then just kind of send us on our way with something that they can call Trump care rather than Obamacare. I'm not sure. Let me know what you think in the comments section. I think it's always great to have just a diversity of opinions and experiences, especially when we talk about this complex healthcare stuff. I think that's it for me. If you really liked what you saw today and you want to stay up to date with the Millennial Project's latest videos, definitely hit that subscribe button at the bottom of the screen. Also, feel free to share what we're doing with your friends, your family, etc. I think it's just always super, super helpful to get supportive shout-outs from viewers. And although you may see an ad here or there for the Millennial Project, I pay for all of those right out of my own pocket. So this thing is like a one-man show, and it just helps so much when people share the work, because it lets me do more videos and investigate more stuff. Last thing is, I do just want to thank the Brookings Institution one more time for this report. I found it very informative, and there will be links to the report itself in the description of this video. All right, that's all I have. Until next time, this is Andrew Davis for the Millennial Project.